9 in 10 African nations are said to miss urgent COVID-19 vaccination goals, says the UN. The United Nations also says that Africa only accounts for less than 1% of the more than 2.1 billion vaccine doses that have been administered globally. Will the heavy rollouts and donation of vaccine doses currently happening eventually result in their uptake? What are the position of governments and the general population on the COVID-19 vaccine on the continent? Let's find out. Hello, I'm Auriane Itangishaka and you're watching Our Voices. Now, vaccine hesitancy around the world is threatening to prolong the deadly pandemic. A report by VOA's Steve Baragona.
When polling firm Gallup asked Czechs whether they would get vaccinated against COVID-19, 53% said no. In Senegal, 55% said no. And in Jordan, 62%. In most of the countries Gallup surveyed, the proportion of people who said they would be vaccinated was below 70%. That's the lowest percentage of the population that scientists think needs to have immunity in order to stop the virus from spreading. It's a state called herd immunity, where the virus has a hard time finding new people to infect. Vaccination is the safest way to get there. Where vaccine hesitancy is highest, it may be about more than just the COVID-19 vaccine itself.
I think the number one thing we have seen from our work is essentially trust in government. That seems to be a strong predictor with regards to intention to get a vaccine.
Take countries such as Ukraine, Gabon, and Lebanon. In a 2018 Wellcome survey, most people there said they did not trust their government. Those countries also have majorities who said they will not take the COVID-19 vaccine. In all, Gallup found 20 countries where more than half the population said they won't take the vaccine. 10 of them are in Eastern Europe. That partly reflects people's attitudes there towards vaccines in general. In that 2018 Wellcome survey, only half of Eastern Europeans considered vaccines safe. That's the lowest rate in the world. These high rates of hesitancy are a warning for health officials, but they do change. When Gallup polled Americans last September, 50% said they would not get vaccinated, but that number fell to 26% by March.
A small proportion of the population here in the United States that is fundamentally and philosophically opposed to vaccines. That's a very small proportion. We then have a good chunk of the population that's pro-vax, but the majority of people in the United States are what we would call this movable middle, i.e. they're ambivalent, and they just need a nudge in the right direction.
One of the biggest nudges is seeing other people get vaccinated. Take this Kaiser Family Foundation poll. In December, when COVID-19 vaccines first arrived, more people said they would wait and see than those who said they would get the shot as soon as possible. From December to April, as more people got vaccinated, the wait and see group shrank from 39% to 15%. But getting hardcore skeptics on board is not easy. It has to be done on a local level, Lemaye said, sometimes person to person.
It has to be from individuals that people trust. This has to be community-based leaders, for example. Religious leaders are a key part of this solution. Other community influencers at the community level are really, really important here. It is a lot of hard work. It's not something that's going to be done very quickly and very easily.
Now let's look at the US's role in offering and delivering vaccine to low and middle income countries, some of which are in Africa, as an effort to curb the disease. The White House has announced it will deliver the bulk of its first 25 million donated doses of COVID-19 vaccines through COVAX, the United Nations-backed program. Steve Baragona tells us more.
3/4 of the first 25 million vaccine doses that the United States is donating will go through the United Nations COVAX program.
This will maximize the number of vaccines available equitably for all countries and will facilitate sharing with those most at risk.
Another 6 million doses will go to individual countries, including neighbors, allies, and countries with surges or other crises. The United States has pledged to donate 80 million doses in all by the end of June.
This is 5 times the number of doses any other country is committed to sharing. And these 80 million doses represent 13% of the total vaccines produced by the United States by the end of this month.
But while 80 million doses will help, Experts say the world is billions of doses short of what it will take to control the pandemic.
Yes, a step in the right direction, but really a drop in the bucket to what the global need is.
While more than half the U.S. population is vaccinated, access to COVID-19 vaccines has been wildly unequal worldwide.
Of the 1.8 billion vaccines administered globally, just 0.4% have been administered in low-income countries. This is ethically, epidemiologically, and economically unacceptable.
Experts say wealthier countries need to step up their donations, plus help build manufacturing capacity around the world. That will take time. One bright spot is that there are still new vaccines in development that may help fulfill the world's needs, Moth says.
We won't just be working with the current kind of portfolio of vaccines. We'll have new vaccines come along, and hopefully they'll be as safe and effective as our current ones.
The WHO this week authorized the vaccine from Sinovac, which is already in use in Brazil, Indonesia, and elsewhere. That clears the way for uptake in more countries. Steve Baragona, VOA News.
Speaking of the effects of trust in places like Zambia, Dr. Nevis Mumba, former vice president and current presidential candidate in the August 2021 elections, is known as an advocate for the need to be cautious to vaccines made in the West. He says Africans must do their due diligence in testing themselves the vaccine given to them before use on their populations. This strong stance is, to some of his critics, the cause for some of the existing COVID-19 vaccine hesitancy among the population.
Zambia must not inject any vaccine in any Zambian body before strenuous verification and validation is done to this vaccine. No injection should be inserted into a body of any Zambian. We must declare that the vaccine is unsafe until it is scientifically proved to be safe. Not by the Americans, like I said, not by the Russians, not by the Europeans, but declared safe by our own scientists and our own doctors. I heard somebody say, where are we going to get scientists and doctors? Well, if you can't verify what is given to you by your own people, then I suggest that you don't get involved in touching things that are made by others, because then you can be poisoned and we can all die like fools, like Martin Luther King Jr. said.
Soon after the video came out, in another interview with Premier Gospel Channel on YouTube, Dr. Mumba said that his statements have made impact on the government and that the leadership of the country has decided to take a closer look at vaccines. We have to take a quick break. When we come back, we will look at the reasons for COVID-19 vaccine hesitancy in some of the nations in Africa. We'll look at nations such as Ivory Coast, Malawi, Burundi, and Zimbabwe. Don't go anywhere. Welcome back with our voices. We're discussing hesitancy in taking the COVID-19 vaccine on the continent. Ivory Coast was the first country to start vaccinating against COVID-19 under the COVAX initiative. But putting shots in the arms of people has not gone without a hitch. VOA's correspondent Mariama Diallo checks on how the country's vaccination effort was doing 3 months after the start of the campaign.
The first doses of the AstraZeneca vaccine arrived in Ivory Coast in late February. By March 1st, the country started vaccinating, an effort made possible by the COVAX scheme, a program co-led by the World Health Organization, Gavi, the Vaccine Alliance, and the Coalition for Epidemic Preparedness Innovations. UNICEF oversees procurement and delivery. Kwaku Epa is an immunization specialist with UNICEF in Ivory Coast.
What COVAX is doing is to make sure the vaccines are available in quantity and quality to help countries attain herd immunity, stop the disease, and if possible, go back to the normal lives we knew before.
So far, the country has used the more than 500,000 doses delivered through the program. Additionally, it was able to secure more vaccines from other nations, including India and France, bringing the total doses to nearly 730,000. The vaccination rollout didn't take place without challenges. However, the country's head of public hygiene says the average Ivorian went through 3 stages in their thinking about the vaccine.
Le premier état, c'est l'état de dire je refuse, je veux pas la vaccination.
In the beginning, most people didn't want to take the vaccine because there was some fake news in social media that the vaccine was going to go through an experimental phase on Africans first. People were very reluctant. After that, we went through a second phase, where people were a bit hesitant. And the third phase, where people were engaged and wanted to take the vaccine when they saw that people who got vaccinated were not showing any major side effects.
Another hurdle came during the AstraZeneca vaccine rollout when many countries suspended its use for a time over concerns of possible blood clots. As of June 9th, the Ivory Coast has over 47,500 COVID cases, with more than 600 deaths, and has vaccinated nearly 607,000 people, according to the country's Ministry of Health and Public Hygiene.
De vaccination, qui était le parc des sports.
We went from one vaccination center at the Palais du Sport Arena in the beginning to now more than over 400 centers across the country. Additionally, we have a dozen mobile units to get closer to the population.
Here at the City Hall of ABOBO, a neighborhood in Abidjan, people gather to get vaccinated. Yao Serge Jesu is the Deputy Director of Communication at the Health Ministry.
So in areas where there aren't many hospitals, these mobile vaccination units are there to fill the void. It also helps to get closer to the communities.
Red Cross volunteer Onyekachi explains the process from registration to getting the shot.
This is where the vaccination takes place.
After the patient gets the shot, Ajayi explains that she must wait 15 minutes to check for side effects. Meanwhile, another resident enters the truck and receives the shot as well. Here is how they both reacted after getting the vaccine.
I came to get vaccinated to protect myself and others, and I wasn't scared.
I came in around 2 or 3 in the afternoon, waited a little, but the most important thing is that I was able to get vaccinated.
Any Ivorians, however, still say they will not get the shot.
No, I will not take the vaccine because I'm afraid that it might be dangerous for my health, so I will not do it.
I don't know anyone close to me who died from the virus, so I don't think the coronavirus exists in Côte d'Ivoire.
Meanwhile, like many countries, the Ivory Coast is offering incentives for people to get vaccinated, like free tickets to the recent soccer match between the Ivorian national team and Burkina Faso.
We just asked all the fans to get vaccinated, and with their vaccination card, they get to see the match for free. It's a concept we just started, and people have been responsive.
As vaccination campaigns continue in the Ivory Coast and other parts of the continent, attitudes toward the vaccine continue to vary. Meanwhile, Ivorian health officials say that in addition to providing vaccines, they'll keep testing for the virus, a task that is also key to controlling the pandemic. Mariama Diallo, VOA News.
Now, Ivory Coast is not unique as a country whose people are hesitant in taking the jab. As reported by VOA's Lamek Messina, in Malawi, health authorities said in June that they shut down more than half of the country's vaccination centers due to the shortage of vaccines and that many people were turned away. However, the vaccine shortage came just a month after the country destroyed nearly 20,000 doses of the AstraZeneca vaccine that had expired in April, partly due to vaccine hesitancy. Now we go to Burundi. As reported by the country's state press during the recent visit for the country's Independence Day commemorations in June, the U.S. ambassador to Burundi, Melanie Higgins, informed President Evariste Ndayishimiye that the U.S. was ready to support the country in its effort to fight the COVID-19 pandemic by providing vaccines through COVAX. However, in his response, President Ndayishimiye informed the U.S. ambassador that Burundi is currently not giving much consideration to COVID-19 vaccines because the populations are doing well in adhering to the prevention measures. In Zimbabwe, the government is facing criticism for turning down a donation of Johnson & Johnson COVID-19 vaccines from the African Union. VOA's Columbus Mavunga reports from Harare that authorities there are not prepared to deal with the refrigeration requirements and possible side effects. However, critics say that there are also politics behind the government's rejection. And the Finance Ministry Secretary, George Muvugantanga, also said that the country does not have the storage facilities required for the vaccines. Harare-based political commentator Joyce Ngwenya said that poor relationships between Zimbabwe and Britain is the reason for Zimbabwe's government rejecting the donation. Mavunga also reports that Dr. Johns Mwangiro, Zimbabwe's junior health minister, refused to comment on the alleged political motivation and reiterate that Zimbabwe will continue to use Chinese and Russian vaccines. We have to take another quick break, but when we come back, we will look at reports of a third wave happening in several countries on the continent. We'll also hear on what experts say about COVID-19 vaccine hesitancy in low-income communities in the Western nations. We have Dr. Lisa Cooper, director of Johns Hopkins Center for Health Equity and Urban Health Institute in the U.S. Don't go anywhere. We'll be right back.
We're bringing women's voices to the conversation, and more than that, we're building a community of inclusion and empowerment.
Here in Kinshasa, campaigns to raise awareness against the spread of coronavirus are common, but getting that information to people who have no access to water, electricity, or money can be a challenge.
We are here at Kalerwe Market in Uganda, Kampala, where in this whole market, women are crying out for their situations to change.
For women, it will be better for us.
I think a big thing for me is just being able to say that when these protests are happening, does it turn around into policy?
Our kids are raped every single day.
This movement got the government to listen. It really was powerful because it showed what is possible when men and women band together and say, enough is enough.
It's not necessary anymore to climb on a car. I can be in any place to cheer with the people.
Welcome back. You're watching Our Voices. At least 20 countries in Africa are in the grip of a third wave of COVID-19 infections, according to Africa's CDC. Yet the rates of vaccinations are still very low. Reports from the Associated Press and produced by VOA's Swahili service.
With the new Delta variant becoming dominant in at least 10 of the 20 countries experiencing a third wave of COVID-19, according to the WHO, less than 2% of Africans being fully vaccinated, and the premature relaxation of restrictions, this surge in cases isn't exactly a surprise, and it could get worse.
In total, on the continent, there have now been almost 5.7 million COVID-19 cases, and 146,000 people, sadly, have lost their lives. New cases have increased for the 7th week running. For Africa, the worst is yet to come as the fast-moving third wave continues to gain speed and new ground in countries.
More vaccines will be available through COVAX in the next few months, but some officials say that's not fast enough.
Let me put it very bluntly. We are not winning in Africa. We are not winning in Africa this battle against the virus. So it really doesn't matter to me at this point whether the vaccines are from COVAX or from anything. What we need is rapid access to vaccines to member states.
Availability isn't the only hurdle. Nations such as Angola and Eswatini made good use of the vaccines received so far, using nearly 100% of their doses, according to the WHO. But many other countries did not, and are still fighting issues regarding access as well as hesitancy. Both need to be solved, or the waves will keep coming.
So we don't want vaccines to be available and people not taking them, or we don't want people who wanted to get vaccinated and not having enough vaccines. The international community need to keep the effort to get the vaccines in Africa, but also local government in Africa need to work on the issue of vaccine hesitancy.
And the mixed messaging isn't helping. For instance, the AstraZeneca vaccine produced in India has been approved by the WHO and been given to many people in Africa, but it's now not being recognized for the European vaccine passport.
The World Health Organization, the EU, the CDC, and also the Chinese, they need to speak the same language. That would help us go out there and convince the people that there is no conspiracy around this vaccine.
The WHO reports that some countries in Africa have yet to receive any vaccines at all. And some experts there say it's an obligation of wealthier nations that have more supplies than they will use to get those vaccines to people who need them. Justine Mullen-Kanzadian, VOA News, Washington, D.C.
Now, what are experts saying about tackling hesitancy and racial disparities in COVID-19 vaccine coverage? At Johns Hopkins University, one of the world's leading schools of medicine, experts provided a media briefing just last month on that very topic. In the briefing, Dr. Lisa Cooper, director of the Center for Health Equity and Urban Health Institute, said that low numbers of vaccinations, especially in low-income communities around the world, are the result of a lack of access to vaccines and existing health disparities.
As you all know, the COVID-19 pandemic has shown a magnifying lens on these disparities. A disproportionate number of the cases, hospitalizations, and deaths from COVID-19 have been among people of color. And even as COVID-19 vaccines have become available, there remain inequities in access to them by race and ethnicity. And although half of American adults and those aged 12 or older are now fully vaccinated, many people living in middle and low-income countries such as India and many countries in Africa and Latin America will not have access to a vaccine until next year or later. Here in the US, vaccination rates are lowest among African Americans and Latinos and across several southern states. There's also a myth that the poor health that's experienced by many socially disadvantaged groups is a direct result of negative attitudes and poor choices made by individuals. But actually, because of centuries of discrimination and social injustice, many people in those communities experiencing health disparities don't want to be unhealthy, they just lack opportunities to make healthier choices.
Now, when leaders from the world's wealthiest nations met at the G7 summit in Cornwall, England, they announced a vaccine sharing initiative that would see 1 billion shots spread across the world. Now, it's up to the aid and advocacy groups for overcoming vaccine hesitancy. VOA's Arashad Arabasadi has more.
Leaders have pledged over 1 billion doses.
That is the promise from the world's wealthiest countries to help some of the world's poorest countries combat COVID-19. The number falls well short of the 11 billion vaccine doses that Oxfam says is needed, calling the G7 summit a failure.
The G7 had a huge opportunity to actually deliver a global roadmap towards fully vaccinating the world. What we've seen is warm words and very little action.
Eloise Todd is co-founder of the Pandemic Action Network. She says numerous hurdles exist to get those billion doses into arms.
There's kind of 3 prongs really to the vaccine strategy, which is procurement, buying the vaccines, delivery, getting them to a place where you can get them in people's arms, not only on the tarmac in the country, but do you have the healthcare workers, the community workers to be able to do that? And then crucially, willingness to receive the vaccine.
Outreach programs to vaccinate communities in developing countries revolve around trusted endorsements from leaders, influencers, and health workers.
If the health workers at the local level, who the communities trust, right, have actually seen that, have communicated that, listen, I'm taking care of it, I'm taking the vaccines because I trust the science, I trust the efficacy. That itself is reinforcing the belief in the vaccines.
Edwin Ikuoria is Africa Executive Director for the One Campaign. He says as more people get vaccinated, hesitancy will drop.
People become ambassadors because the fear is that if you take it, you will die. If you take it, you will be sterilized. If you take it, all kinds of things. So when people who have taken the vaccines also come out to talk about the benefits of how their life is going back to normal, how they are not afraid, how they are also, living healthier and all of that. They become a part of the whole program of getting others who are not, to come on board.
The experts say success overcoming hesitancy in developing countries ultimately depends on having enough vaccines and enough people to administer them. Arash Arabasadi, VOA News.
Before we wrap up today's program, we bring you voices from the streets of Nigeria where we ask people what they thought about the vaccine and whether they plan to get vaccinated or not. Here's what they had to say.
Yeah, I have not taken the vaccine because the whole exercise came at a rush hour. So we want our local doctors, local experts to examine the vaccine very well, to study it very well before I will be convincing to take the vaccine.
I'm waiting for the best opportunity to get vaccinated. I think it's a good thing to do, at least to keep myself safe from others and interacting with other people. It's really a good one to do, but when I get the opportunity to get vaccinated, I actually go for it. As a broadcaster, I'm at the forefront of many events. I'll get to get contact with so many people. So I'm waiting for that opportunity, the equipment being in place and every other necessities so that I can get vaccinated.
The company where I worked, it's because they have not bring it to us. So that's why I cannot go to a vaccination center to go and take it. So I expect that the company which I am working on that should bring the vaccine in the company so that the staff can partake in the vaccine. That's why I've not been able to take the vaccine.
I've not taken the vaccine. There is no specific reason why I've not taken it. It's just I've not had the time to find out where around my area I can actually take the vaccine. So when I have the time, I'll definitely do that and get myself and my family vaccinated. But I'm excited that Africa is taking interest in also producing it for themselves, not relying on the Western countries to produce and bring in for us. So if we can do that in Africa, I think it will make all the difference.
That's it for us this week. On behalf of my colleagues here at VOA and on behalf of our voices, thank you for being with us on this program. Have a wonderful day.